Good morning, everyone. Welcome to the weekend. Welcome to Saturday. It's time for us to ask what you got. Today we're talking about the International Day to End Obstetric Fistula, featuring the Aziza Project. Today is the International Day to End Obstetric Fistula. This is a day of awareness, compassion, and action. Obstetric fistula is a childbirth injury that affects women in regions with limited access to medical care. It's preventable, it's treatable, and it should not exist in our world today. So today we're going to ask you, what can you do? And what you got?
Hi, friends, it's me, Barry. Good morning. It is a great day to come together and ask the question, what you got?
Okay, so I went a little early on the intro. Please forgive me. It is Saturday, so I'm not working. Actually, I'm not working. This is recorded. If you look at Thursday, I'm wearing the same shirt. Actually, if you look at yesterday, I'm wearing the same shirt. It's just underneath my jersey. So, I'm recording. But it doesn't change the message. Our mission partner of the day is the Aziza Project. They work to support women, providing education and bringing healing to communities affected by many different conditions. Obstetric fistula. Please forgive me. I do not mean to mess this up. This is a very serious thing. By the way, my name is Zach Clayton, Community Pay It Forward, the Come Together Compass, in the PAC channel, podcasting networks. I am very glad to meet you today, and I hope that this is something that can help you or help you help others. Once again, obstetric fistula occurs when prolonged labor happens without medical intervention. It leaves women with physical injuries, emotional trauma, and social isolation. Many women who experience fistula are abandoned or shamed, even though the injury is a result of inadequate medical resources. Not personal failure. The United Nations first recognized this day in 2013 to shine a light on a condition that is often hidden. Ending obstetric fistula requires access to skilled birth attendants, emergency obstetric care, and community education. It requires compassion and global commitment. That's pretty sad that because I'm messing up that one word, I see a word like requires and I get messed up on that one. This is again one of those that I don't know a lot about, but I do have experience with people who have suffered with different injuries of the gynecological issue. So this is a very serious situation, and our mission partner is one of the kindest, warmest people I have ever met in my life. And she is compassionate and works very hard on a limited budget to do what she can to find solutions for women everywhere. I beg of you, please support the Aziza Project. You can do that by scanning this code. You can also find out so much more about her by visiting the website, which is included in this code, and you can sit there and make your shopping count with the Community Pay It Forward program. All you have to do is scan the code, attach a receipt, and make sure that you find out more about what they do. A lot of her work is brought on by not just impatience and ignorance, but a lack of education in the medical field. So the Aziza Project is part of that commitment. They provide support, resources, and advocacy for women who have experienced fistula. They help women reclaim their health, their dignity, and their future. Again, Stephanie is one of the strongest people I have ever met while she's going through some of the most horrific things. She is taking a situation that could truly hurt somebody mentally, physically, emotionally. And she's standing up to it and saying, damn it, that's enough. We need to do something better for others. And Stephanie, I love you for doing this. I love you for doing that. You know that I have a personal tie-in to this, because the emotional impact of obstetric fistula can be devastating. Women often face shame, isolation, and depression. Healing requires more than medical treatment. It requires a community, understanding, and mental health support. When we stand with these women, we can help restore hope that rebuilds lives. Doctors, through all the stuff that Stephanie does, told someone repeatedly, someone I know and loved, told someone repeatedly that we cannot find anything wrong with you. And after about 15 years, I started to believe them doctors. Why would they say this for 15 years? And it's devastating to learn that this is a problem, and that I didn't do everything in my power to make sure that this problem was taken care of. I beg of you, if you've got somebody who is a female who's complaining about pain, use the QR code. Talk to Stephanie. It's a conversation that not only is going to open your eyes, it's also going to help you understand the situation. And very possibly it's going to lead to a solution for the one that you love, that you're trying to help. So today, I ask you, what you got? What is a situation in your life that you've allowed somebody to talk you out of believing? Is there a situation where someone, after years and years and years of you questioning, has convinced you that there was, that the answer was different? Whether it's personal sports. Let's try not to go political right now, folks. Political's too much of a hellhole. I don't want to get into that. But health. Were you ever in a situation where, look, I'll be honest with you. For years and years now, for over a decade, I have dealt with this neck problem. That I keep hearing from doctors that it's not, that surgery could help, but we don't want to do surgery. Well, let's try this before we do surgery. After a decade, you kind of get sick and tired of trying things and you just want to feel better. Well, I understand. I just wish I would have understood earlier. So, that's your question of the day. The ask of the day is very simple. If you've got somebody who's confused, if you've got somebody who is in pain, and if you've got somebody who just needs help, let's take a second look at that today. Even if you've got doubts, let's take a second look and see what we can do to maybe help them figure it out. It could be all in their head. But that doesn't mean we should stop looking. And it definitely doesn't mean that someone else and their diagnosis is correct. So today, let's raise our voices for women who deserve safe childbirth, safe lives, compassionate care, and a life free from stigma. Let us honor the work of the Aziza Project. Protect and commit to a world where no woman suffers from preventable injuries. And every woman is taken care of. My name is Zach Clayton, President and Founder, Community Pay Up Forward, the Come Together Compass, and Pact Podcasting Networks. Reminding you that if you're not helping someone, you're hurting everyone. Please, love someone out there because someone out here loves you. And remember, no one needs to be confused and walk a path alone if we all come together. Ask them questions. Ask them what you can do. And help them out by telling them what you got.